Thank you very much. And Eloy was my mentor in the field of IT. If the story goes, I'll start with the story before I talk. There was a foreign student that wanted to rotate at the Philippine General Hospital, and her fax to me stated that she wanted to communicate to me by email. And Eloy told me, who was a first-year resident then, "You're a professor, you have a access to email." This was in 1990. And we worked with bulletin boards and monochrome computers, and our university was connected to different computers all over the world. So we started playing around with all of this, and we eventually worked a lot together. I continued my work in the field of trauma, but never lost interest in the field of gadgets and IT. And now he's really putting me on the floor by asking all my big shot mentors to actually comment on how the Department of Health wants to really plan to implement the eHealth strategy for all of us. This is a conference, the eHealth Summit, that I think should have happened 10 years ago. And some of you already have done a lot of work, major work, in the field of eHealth. And everyone here who's sitting here and who's crossed over to that other side has a stake in trying to make eHealth better in the Philippines. So as a backgrounder, we are all here because information technology has become very much affordable. And I will prove that because everybody has a cell phone and a computer actually in their pocket. These are the phone, the Androids and the iPhones that you have now were more powerful than the email and bulletin board computers we were using to connect to the different universities way back in the early 90s. Yet despite this, we use IT for banking, for our credit card system, for our phone billing system, when you buy your groceries, when you pay for your gasoline. Yet it's not been effectively used in the health sector. We still use very much traditional pen and paper, especially in government health institutions. And tremendous benefits can be gained if we really understand that a lot of the processes in the health system, in the provision and service delivery, in diagnostics, in prevention, in promotion, in disasters, can actually be highlighted by good IT. So in order to make that happen, all of you are here, you're all interested to use some form of IT technology, information technology in some way. And we've had a lot of difficulty trying to standardize what comes into mainstream and what gets discarded after 6 months of a newer technology, which is basically what happens to our cell phones. And the DOH, the Department of Science and Technology, with the guidance of the World Health Organization, crafted what we called the Philippine eHealth Strategic Framework and Plan. And this, I think, is major work in where our direction would go. It's like telling us where we're going and what pathways or transport or railroad we're going to use in the method. It's our roadmap, and this will be the plan of how we will actually use IT to improve healthcare in this country. So as mentioned earlier by our two secretaries, Secretary Ona and Secretary Montejo, they jointly work together and continue to actually chair this joint project by managing what is called the Philippine eHealth Strategic Framework Plan. And in July of 2013, last year, a joint national eHealth governance structure was actually formed. And this is very important in terms of thinking, if you want to go somewhere, who will be your leaders? Who will be your drivers? And the DOH and the DOST participated in a write shop together with the WHO, and they came out with a national eHealth strategy toolkit, which basically maps our framework. The development framework is mapped out very well. It talks about leadership and governance as a key and important factor in having a national eHealth strategy. It also talks about strategic investments, service applications, policy legislations that will be very important as we implement new methods of doing things, new processes in healthcare. Standards and interoperability is actually a very important and core to this concept of this framework. And to those who've heard me present this before, the Health Information Exchange actually takes in all of this. The infrastructure, you see outside white space being exhibited as well. This is use of infrastructure that can actually hasten what we intend to do for healthcare. And of course, very important, the production of a very robust health workforce that can provide the brain power to actually fuel the development of this e-health strategy. For leadership and governance, we have two very important leaders, Secretary Ona and Secretary Montejo, in the health sector. And below them is a steering committee that will actually steer and probably do all the dirty work in terms of making sure that all the plans and strategies go out smoothly without bumps. Then we create another technical team, which is the eHealth strategy team, and then everyone else is either a stakeholder, a vendor, or in the private sector, in government, and all of this benefits to each and every patient that the health system touches. So the whole framework covers all stakeholders, and the key is to have good guidance on where the direction should go that will implement our health system. So these are some of the important names that's been actually put on. You'll see PhilHealth there, Department of Health, DOST, even CHED. And we actually have the Philippine Health Information Network of everybody. The technical working group are composed of our IT people in both the DOST, DOH, and PhilHealth. And then we also have other groups that have helped us, like for example, ICT for Health have been helping us for a long time through the private sector, pushing developments in eHealth. And this will continue to help us. Experts who will help us with data standards in health and security. Two very important issues that up to now may be the major stumbling block of any system that you want to implement. And I repeat that, standards, security. For strategy, investment, legislation, policy, and compliance, it's really very important that the two married each other. Because basically, we will spend money on which technology we will implement. And that's very important, that the people who sell us or sell to government what will be implemented in the eHealth roadmap will actually those that will be resistant to changes or new technology, what we call disruptive technologies. You embrace one new technology and next month there's a disruptive technology that dissipates all the investments that you put in. So we're making it very open, very vendor neutral, very much responsive to the very fast changes in technology. There are also important standards. For example, I think one of the things we want to look at is COBIT, right? And we're trying to look at how to implement it in terms of being able to have a standard policy in terms of compliance. So basically, what the steering committee and the governance committee does is just make the rules of the ball game, and then everybody can play in this particular system. And of course, the capacity building for the workforce. No new technology will work without the peopleware. And the peopleware is actually the most important part. You know this is the most difficult. I was just speaking to Iris about their program in Masters in Health Informatics and how I'm writing recommendations to them when they're applying abroad after they finish their Masters in IT. They're graduates, Eloy. And because they are in demand in the Middle East, in Australia, in North America, in Europe. But these are bright Filipinos who've taken up this challenge, and we need to somehow retain them to be able to fuel and be the workforce for this framework for eHealth. And with that, we'd probably look at a national eHealth capacity roadmap, which talks about certification. Very important that international groups that come in here understand exactly who our IT professionals are, what their levels of capability are, and what their certifications are. So eventually, this is one of the things that governance and what government does is actually certify. So we're trying to build this up and develop different levels of certification of who can handle which type of system or technology, and it makes government easier to actually implement such programs. And of course, this is not a sole island. It is part of the whole development of the whole government trying to implement iGov Philippines, which is really the main idea of making the whole government more responsive, less bureaucratic, be able to be transparent, and all the information available to all the stakeholders and taxpayers. And this is all in partnership with that whole infrastructure that DOST is making available to all of us. So that's why it's very important that the partnership goes hand in hand with the ICT office of DOST and the Department of Health's IMS and the IT people, even including PhilHealth. This is probably the most contentious part of eHealth and any eHealth technology. That's why there is no standard if you try to look at other countries that implement some form of electronic records. It's because of the issues of standards and interoperability. And there are many vendors out there, many electronic medical record systems, many proprietary softwares that develop. Our roadmap will be vendor neutral. It will be an open system. It will be inoperable. So if you are already on it with some sort of system, what we want to do is bridge you so that you can be able to be on this health information exchange mode. And this is what some of you have seen. We presented this, the standards for interoperability, wherein we have a health information exchange, integration module, wherein you can be able to actually connect to a health information. And that gives us, in the health governance, the power of computing. Because the power of computing today is big data and analytics, registries, information that will change policy, financing, and everything else. So very important to look at this, that we will look at disease registries, provider registries, patient registries. We share that health record. We look at injury, cancer, our non-communicable diseases, which are top killers, but have very little funding because there's even no national data. And then standards and terminology, we're all on ICD-10 because the financing system is on ICD-10, so we're already on that. And then all others will be in the provider side. We're in hospital information systems, electronic medical records, laboratory information, picture archiving systems, radiology information systems, and even telemedicine to the remote rural areas, which has always been mentioned and presented in the video in the earlier session. Of course, the medium-term plans for IT have already been laid out and mentioned by Secretary Ona, and this is the foundation of this particular summit. We want all these services and applications to be heard. Eloy was telling me maybe the best way is to get everybody who is similar, birds of the same feather, come together, and then you talk to the steering committee and present your proposals on what can be done on eHealth. Maybe that's the next step or the next meeting. People in hospital information, people in telemedicine can group together, and then we can work out what can be. Should we divide the country by region, by hospital, by political affiliation? It doesn't matter. What is important is that everyone is interoperable and goes to the health information exchange, and we at the governance level have the idea of what needs funding, what is the major public health issue, what are the requirements, what are the gaps in terms of deliverables, in terms of who are not having access, how can we improve access. There's a group talking about lack of doctors and manpower. I think I have a breakfast meeting with them tomorrow. Telemedicine may just change all of that ratio and statistics because of the presence of the specialists in urban centers. Their expertise become available to an ultrasound technician, to a pregnant woman in a remote rural health unit. So these are the things that we look at. We're really very open, and we're looking at interoperable. This is what we learned from other countries that have implemented an eHealth program. Other countries implemented a program, and then they realized they tied up to some interface. And it cannot progress because a new technology is developed. So we're not as rich to spend for proprietary. We will partner with private sector. We will do a lot of public-private partnerships. We will do a lot of service contracts. But I don't think government should be investing on technology that can become obsolescent. So this is my last slide, and basically I hope I've challenged all of one who's interested in eHealth and continue to become interested now that there is a roadmap. The next step is really broader engagement of all of you. All of you who are interested, to be part of this journey of the Philippine Health Information Network in making healthcare really better, achieving universal healthcare, access to healthcare for all Filipinos. We've achieved the financing because of the sin taxes. We are achieving the modernization of our health centers through additional funding from government. And I think the next step is really being able to deliver what we call access and quality healthcare to the people. This is very important. A lot of people approach me here during this conference. The first thing they tell me is, Usec Herbosa, we work with the private sector. And I think you all know that the private sector is the first to embrace IT for efficiency, for gains, for added profit. I don't know why they think government shouldn't be part of it. I think it should be a big picture, and I tell them, go ahead and invest in the private sector, spend money. Will actually be good for government because we'll learn what really works later on. Because the survivor and the ones that actually proliferate and becomes popular is probably what will be useful for government as well. But we're also open to partner with the private sector, because if you ask government to do something as this, by the time we finish the procurement following 9184, Republic Act, the Government Procurement Act, the technology is already outmoded and there's a new technology. And we've seen that in the past. We've seen computers bought by government. By the time they are delivered, it is two versions lower than the actual time that it's actually been in the market. Then, of course, the importance of being able to prioritize. We're still up there with our economic struggle to become a economically sound country. We need to have prioritization in what we need to deploy first. We have to be very clear with what we need to invest in. And it's very important that we prioritize which areas will develop. For example, I take you an example and I learn from it. I know our home has started to try to implement a hospital information management system, but they approach it the reverse of what I personally think, should be the way to actually implement IT in our hospitals. Because they went to the patient records first before they went to what earns money. Because what earns money is your imaging. If I put teleradiology first on the line and computerize it, actually I'll pay it, it will pay for itself because you will do more imaging. Same with laboratory, same with pharmacy. But we've implemented that way because we didn't see it that way. It's always hindsight is always clear. But today, we have that opportunity. We're buying a lot of modern equipment, and we're increasing the imaging capability of our public hospitals. I'm always pushing, and there are now vendors out there that sell only the service of picture archiving. And what this will do is it can now connect to the remote rural health units and then be able to actually get your dream of teleradiology and network health systems that actually will provide services without moving a radiologist to or a sonographer all the way to a rural health unit or a district hospital. So it's very important to have an understanding of what really is the priority. And this is where the private sector really will help government. We need to fast-track this capacity building, from the workforce to the infrastructure to the policies. Because as you know, government does not work as fast as technologies or apps are invented. Every new health app, I think health apps are the most numbers being invented right now, right? If you look at the numbers from games to health applications. And I think our telecoms people are also going into this. Even I think Samsung and Apple are going into what we call health-related apps. And I think that's what we need to look at. Iris showed me a website of a doctor offering consultations online. Very interesting, and it's coming out of Cebu. Do we have the legislation for this? Do we have the rules and the necessary stuff? So we can fast-track it, but we also have to match it with proper legislation and funding. So with that, I'd like to thank you all for your interest in understanding the eHealth roadmap, and I do hope that we all get to our direction of better health outcomes for all Filipinos with the use of IT. Maraming salamat po. Mabuhay kayong lahat.